In this video, you're going to be able to be a fly on the wall and watch me treat a patient that has a long-standing elbow problem, and you're going to be able to see exactly how I approach these types of problems. If you like my videos, give me a thumbs up, subscribe to the channel, hit the bell notification, and I hope this video is informative to you to learn what real treatment looks like for this type of elbow problem. So enjoy the video. So this person has pain and discomfort right here on the elbow, and I'm going to show you how we've been working on it. So the way to test it is to bend the wrist forward and then have him push upwards, backwards, like you're riding a motorcycle. So go ahead and push up. And does that cause pain? So if the patient says they have pain, that's testing for the tendons of the elbow. And then through palpation, I can actually feel which muscle and tendon it is. So if I go right here, this is the extensor carpi radialis longus that's right kind of near the radial head. Then there's the extensor carpi radialis brevis, then the extensor carpi ulnaris, which is where he primarily gets the symptoms. So what I do is I trap the muscle right there with my thumb, get underneath it, apply pressure, and then I flex forward. And it's important to not push too hard, but not push too easily either. There's a right feel for it, because if you do it too hard, you can actually compress the muscle against the bone, causing further damage. And if you press too little, basically the patient does not really show any signs of improvement. So as I do this here, you can see I'm flexing the wrist, which lengthens the muscle. And as I do this, we're stretching the tissue, especially the scar tissue and the fascia, through this area on the extensor carpi ulnaris. So then I'm going to do an adjustment to the radial head, and then I will show you the exercise that best helps this type of problem. So I do about 10 rotations of this, and now I'm going to adjust the radial head. So it's important to be directly on it. So I'm going to rotate the wrist, which helps me find and feel where the radial head is. Then I'm going to pronate the wrist, lock out the elbow, and just very gently adjust it just like that. And then here's the exercise. What you do is you put a rubber band around the fingers, keeping the wrist extended like that. He'll extend his fingers. Show me how to do it wrong. Extend it really too far, so the rubber band, see now the rubber band went over, that was too much of an extension. So you want it just enough that you get extension and the fingers go out like that. And you just do it until you start to feel a burning sensation in your forearm. Do it a couple times a day, and that gets a lot of blood flow in there. And that will cure things like tennis elbow, radial head subluxations, ligament damage, tendonitis, adhesions of the muscles. The key to the treatment is to know exactly what muscle it is so you can apply a manual myofascial release to it.